News 4 is also watching out for those of you in the Metro East tonight. The lack of ICU beds is what's holding up restaurants from reopening their doors. News 4's Jenna Ray finds out where those numbers are coming from.
I'm extremely frustrated. I have employees who want to work. I have good employees, and it's been really difficult trying to keep them.
We're generally down about 70% year over year for the month. And it's tough to sustain that.
These Metro East restaurant owners are fed up. Indoor dining has been closed for months, and now they're at their wits' end.
If we're closed, how are we affecting ICU beds?
For weeks now, this region has been stuck in Tier 2. So what's that mean? It means a lack of ICU beds is keeping indoor dining closed. To change that, the region needs at least 20% of its ICU beds to be available. For the last week, I've been trying to see exactly where these ICU numbers are coming from. However, nearly every local hospital, health department, and the regional task force have directed me back to the state.
What's the way out? What's the way forward? If ICU bed availability is a challenge, what's the solution to improving that, especially in light of reduced coronavirus cases?
According to the Illinois Department of Public Health, over the last 9 days, this part of Illinois has seen a steady decrease in COVID-19 patients. ICU bed capacity is not following that same trend, so I wanted to know how many of those beds are occupied by COVID patients. A spokesperson at IDPH tells me there are 109 ICU beds in the region. 91 of those are in use, but only 26 of the beds in use are COVID patients. That's less than a quarter of total bed capacity. That spokesperson also tells me the type of patient isn't a factor. It's ICU capacity as a whole. So the question remains, if COVID didn't exist, would an 80% full ICU cause restaurants to close down? I'm still waiting on that response from IDPH. Metro East business owners tell me they just want to open at limited capacity instead of putting people in tents outside as an accommodation.
We have 9 different ventilation systems in this facility. You can't tell me that that's not safer than being wrapped in a plastic bubble.
Reporting in the Metro East, Jenna Ray, News 4.
As you heard Jenna mention, she was waiting on the state for more explanation. Well, in the last few minutes, they have responded. The spokesperson says even outside of COVID, restrictions can be made. They say if healthcare is at risk of being overwhelmed, measures can be put in place.